Hey guys, it's Dr. Kelsey and this is Jet, our Labrador Retriever. He's just chilling out with us, and I want to talk to you for a minute about cruciate tears or ACL tears, or people say, you know, my dog blew out its knee. That's what I want to talk about just for a few minutes about this. Luckily, this has not happened to Jet, but we're just using him because Labradors unfortunately do have this happen fairly often. We see probably 2 or 3 cases a month, unfortunately, with dogs. But let me explain the anatomy a little bit on the ACL tear. So this is a knee model, and their foot's down here and their hips up here, and they have a kneecap, of course, which is right here. But if you look in the middle, in the center, there is a ligament. There's a ligament I put a little marker on. That's kind of got a highlight. But anyway, it's a ligament that connects the femur to the tibia. Okay, so the femur to the tibia is connected by that ligament. So in that ligament, it's kind of like a rope in a sense that there's, you know, fibers and stuff. It's not like a fishing line. It's like monofilament. It's not like that. So you can get what are called partial tears sometimes in that knee, where some of the fibers tear, maybe 20%, and the dog's lame. But then eventually, usually they will have a full tear. Okay, so when your dog has a full tear, generally you're going to see a dog that's totally holding up its leg. They will have run outside, you know, chase the squirrel, run after the ball, and they come back and they're holding that leg completely up in the air. Obviously, you need to bring them in. We can evaluate them. Sometimes we have to sedate them to evaluate it to, you know, to get them relaxed. But we can do a few manipulations of the knee. A lot of times we'll take x-rays as well to make sure there's nothing else going on in the knee. But we can feel and see if that ligament's loose and has torn. Once we make that diagnosis, you know, generally we recommend surgery for those dogs. There's several surgeries that are done. There are some surgeons, there are some surgeons that do a surgery called a TPLO. A TPLO is a very good surgery that they do, kind of an 8 to 12 week recovery on that. General practitioners like myself, there's some other techniques that can be done that work, you know, fairly well for moderate or medium-sized dogs or smaller dogs. I always recommend a TPLO for bigger dogs, especially like Jet here. He would have to have one if he had one. Hopefully not, buddy. TPLO is one. Again, the general practitioners like myself do a couple other different techniques. And the whole point, there's no way to go in there and fix that ligament. But you can stabilize that ligament by doing the surgery and stabilize the knee, I should say, not the ligament, stabilize the knee by doing the surgeries. So usually, again, 8 to 12 weeks out after surgery, you know, your dog's going to be at 90%, maybe, you know, 95+% of function, which is great. We'll a lot of times put them on anti-inflammatories and anti-inflammatories and glucosamine and chondroitin products for their knee, because going forward they're going to have arthritis in that knee because that ligament tore, the dog's had knee surgery, but they do really well. So, you know, I don't want to discourage anyone if your dog's had that surgery, or I mean has had that problem or has that problem. It's definitely not a death sentence by any means. It's something that's repairable, fixable, and the dogs do quite well, you know, 2 or 3 months out. So hope that helps a little bit about the ACL tears in dogs. Hey guys, it's Dr. Kelsey. Thanks for watching that video. If you like what you see, we'd love for you to subscribe and follow us. We're always trying to put out great content on a weekly basis, so continue to subscribe and watch us.